stress fractures. Hello, I'm Dr. Mohit Arora. I'm working as a consultant orthopedic surgeon. I welcome you all in this video wherein I'll be talking to you about stress fractures. So basically, as you know, in this environment, a lot of people are moving towards athletic activities, and you see, especially in Gurgaon, there are so many marathons going around, throughout the year, and it's good to run the marathons, but then people come to me with the problem of pain in the leg, pain around the hip, pain in the foot. So especially those persons who are involved in long running, and sometimes I get patients like who are there for army recruits, so they need to work on their physical activity before they get recruited into the army. So these subset of patients, sometimes they present to me with pain in the hip, pain in the leg, thigh or foot. So basically what they suffer from the condition is the condition of a stress fracture. Now stress fracture is basically it's a micro fracture which is because of repetitive stress injury like prolonged running, and that happens in a normal bone. However, sometimes in these patients I see they sometimes have weak bones, and if you do the bone profile of these patients, sometimes their vitamin D comes out to be very low, or alkaline phosphatase comes out to be very high. So in that case, we have to treat the the blood markers accordingly. Now the different type of stress fracture that I see in my clinical practice is femoral neck stress fracture, wherein the femoral neck, there is a stress fracture onto the compressive side of the femoral neck. Now the patient usually presents with pain in the hip joint, and the movements are painful, and on the on getting an x-ray done, sometimes we see kind of a healing or callus formation, but then MRI is the investigation of choice in all kind of stress fractures. So a femoral neck stress fracture can be managed conservatively if the involvement is less than 50%. However, if the involvement is of the neck is more than 50%, and there is a very high chance of impending fracture, then we need to fix that fracture by surgical means. Now the other thing is femoral shaft stress fracture, wherein you see evidence of stress fracture in the shaft, and the other area which gets involved is tibia. We call them shin splints, or pain in the legs, and if you get an x-ray, they usually show healing or callus formation during the later stage of stress fractures. However, in the initial stage, there is usually no findings on x-rays, but MRI is the investigation of choice. Now there is another thing called march fracture, which is very common, who are involved in marching and marching soldiers. So therein you get a fracture of the metatarsals of the foot. Now basically, so the overall bone health is it's not bad, it's almost close to normal. So we correct the blood parameters. If there is a stress fracture in females, we need to rule out that female athlete triad, wherein there is a condition involving females which manifests as anorexia and osteoporosis and stress fracture. So we need to manage all the things in a holistic way. And as far as the management is concerned, the first and foremost important thing is avoidance of that activity which is giving you pain. So take a break from the athletic activity. Then you do rest, icing, limb elevation, plenty of if vitamin D, if your vitamin D is low, then protein and calcium rich diet. And usually, because the bone is normal, everything is normal, it heals. If you give time to the body, it heals by itself. But sometimes there are conditions like, if the stress fracture is in an area of femoral neck and where there is a chances of impending fracture, so we need to fix that prophylactically, or we need to fix the femoral shaft or tibial shaft stress fractures, if we feel there is an impending fracture, we need to fix them with intramedullary nails. Thank you.